Welcome back to the IndeVets Happy Hour. I am your host, Dr. Andrew Heller, DVM. I'm here with my co-host, Marisa Brunetti.
VMD.
VMD, of course, we got to get that right.
It's Friday afternoon.
Yes, cheers. We are drinking local beers today, right?
Yeah, I think from King of Prussia, right? And Allentown.
Yeah.
Pennsylvania.
This is really delicious. I have to say, I'm sipping on a nice lager. It's a hot day, so it's hitting the spot for me.
It's beautiful outside.
It's so nice.
Speaking of hot.
Yeah, hot. It's so hot out. It's so hot out. Well, we are going to be continuing our summer series.
Hot Pet Summer.
Hot Pet Summer. Woo! Jingle, jingle.
Ross, make a jingle.
Make a jingle.
Okay, here is the jingle as requested. Enjoy.
It's a hot pet summer, so you know she got it lit.
A note to our listeners, Marisa and Andrew didn't hear that jingle live. I'm adding this in later, so they didn't hear it. They're hearing it for the first time right now, probably as you are. So I hope they like it, and I hope you did too. A little backstory on it. If you don't know, Hot Girl Summer is associated with the performing artist Megan Thee Stallion from her song Hot Girl Summer featuring Nicki Minaj and Ty Dolla $ign. And in it, they're singing about Hot Girl Summer. And, for this series, it's a play on that. It's Hot Pet Summer. So I'll just play the jingle one more time. And now that you know that, if you didn't know it before, maybe you'll have a new appreciation for it. Maybe you'll like it less. I don't know. So here it is.
It's a hot pet summer, so you know she got it lit.
Today, last time we did heat stroke, which is really, really interesting to just study and to refresh my memory on. Today, we want to talk about July 4th. It's coming up, and along with July 4th comes noise, firecrackers. Let's talk about noise phobias in general and talk about what we can do to address it, to prevent it, to treat it.
Obviously, with our Hot Pet Summer series, we're doing a dual audience. So this will help both pet owners and veterinary professionals. Because July 4th is a great time for parties and fireworks for us, doesn't necessarily mean that it's the same for pets. And my own personal dog is terrified of loud noises, including fireworks. So we're here to reiterate that it's not just your pet being scared. It can actually lead to severe disease in pets. And the most important thing we want to get across to pet owners is that you need to be prepared in advance for these things.
Well, and I can speak from my own experience. Every year I tell myself, next year I better give my dog some meds before July 4th because she goes crazy. Some Trazadone, we'll get into that.
Well, luckily there's many different options, right?
Many.
For keeping dogs calm and relaxed during times of stress. But like I said, they require preparation. And so we'll go over not only the meds you have to get from your vet, but also some really cool supplements and other behavioral modification techniques that you can use for your dog if you find yourself without the lovely Trazadone.
One other thing I want to add, since we're talking about July 4th, we're not going to put this in the podcast too much, but I also want to say corn cobs.
Oh, so bad.
Because when I was in emergency, every July 4th I would see something come in with an obstruction, a GI obstruction, and it was always a corn cob. So
yeah.
Beware the corn cob.
And not even July 4th, right? Like
summer all along.
Yeah, summer, corn is in season, and people like to throw the corn cobs to their dogs after they eat them, and that is a very bad idea. So very important. Know where your corn cobs are at all times.
All right, so let's talk about noise phobias and anxiety.
Andrew, why don't you give us a little bit of background about this disease process or noise phobias and anxiety in dogs?
Great. Well, I was able to do some research here. I did not know these statistics. So some of the things that I did learn were 40% of dogs actually suffer from fear of noises. And they're not sure about cats. I think everybody who has a cat probably sees them hiding out when they're scared of sounds and things like that. So it's not as easy to witness. It's not as easy to notice in your cats, which is probably why it's not as reported. But dogs, super easy to see that they're anxious from noises. They show much more outward effects than cats. Some of those effects we think of as, if you remember back to vet school, SLUD, right? So salivation, what was the L? Lacrimation?
Yes.
Urination, defecation, vomiting, destruction, right? They pant, they pace. Many dogs will shake and tremble. And certainly we all know they vocalize, they whine, they bark. potentially howl. Like I have a hound dog, so she howls.
Mm-hmm.
And something that most people don't know is mydriasis. Their pupils will
Dilate.
dilate.
Yeah.
Thank you.
And my own dog, I mean, you mentioned escape behaviors, which I think for a lot of anxious dogs, you may have the dog that scratches at the garage door to get out. My dog, when she's scared, tumbles under every bed in the house. So if there's a bed around, she'll be under it.
That's so sad. Poor Lohi.
It's very sad.
So the important thing about this is it's not funny. It's not something that we should take lightly because they can actually really injure themselves. They can be not just destructive to your house, but they can be destructive to themselves. They can chew on things. We see dogs with ground down teeth that are anxious in their
broken
crates.
teeth.
Or broken teeth. They can scratch at things, at doors and their crates and things like that, especially when people put them in there. If they're left outside, they can certainly be self-destructive as well, biting at their feet, at their fur. It's slightly different with storms. So, storms are something that you can't predict. I mean, it's raining, there's a thunderstorm coming, but you don't know when the noise is going to happen.
And do you think that pets know before we know, probably?
The storm, probably.
Yeah.
They're probably hearing it far in the distance.
Sure, or
and
like
we
the
can't hear
barometric pressure changes, and they probably know before we do.
So, Marisa, you probably, just in your experience, know a bunch of breeds that are scaredy cats, so to speak. Which ones come to mind for you?
Couple things. Thank you for the research, but younger dogs are more affected than older.
Yeah.
And they're just less used to the noises, right? Or they haven't been socialized properly to that. They haven't been trained appropriately yet. And age can be one predisposition. Genetics is also a predisposition. Obviously, we know in us, anxiety runs in families. And the literature points to actually very breed-specific genetics for anxiety. Border Collies, actually, German Shepherds, and Labs being the most common anxious breeds, which I think are interesting, especially German Shepherds, who are doing a lot of the work in stressful situations. I wouldn't have expected them to be pretty anxious, but Labs, oh my God, yes. And Border Collies, like the pacing and everything.
Yeah, and I always think of like Shiba Inus. I know that's not one of the reported breeds, but they're always so anxious. At least in the vet's office.
Yeah,
they're so highly strung.
Yeah,
I'm always surprised when I see a Shiba Inu that is like totally relaxed.
Same. Although I feel like anxiety is increasing in our pets, just like it's increasing in us, especially in this past year.
Yeah.
And so I think it's interesting, actually, there was a study done in 2015 that found that dogs with separation anxiety and noise phobia had less daily exercise compared to those that did not have those conditions. And I think that makes absolute sense, right? If you're a human that has social anxiety, you're not going to leave your house.
And psychologists will probably tell you, go out and run, go and exercise, because a lot of times that helps with mental issues as well.
Yeah.
Stress, things like that.
But I think it's really good to show that if your dog is anxious, that's more of a reason to get some medications or supplements on board so your dog can have adequate social contact and adequate exercise to make them feel better.
Right. I think anxiety as a general topic is something that we could probably do another podcast on in its entirety.
True.
But we want to talk about, what can be done about specific noises associated with the summer, fireworks, thunderstorms, things like that.
Yeah. Like, how do our pet owners prevent these anxiety reactions in their pets? How do we make them more comfortable?
I think that the key is knowing that they're coming and then taking precautions. So removing them from the stimuli themselves. I think this is something that most people forget to do, or they just don't think that they can. It's July 4th. Put a white noise machine on. Put the radio on. Do something that drowns out those sounds. I think that'll go a long way. If you can, put them in a soundproof room, in a room that's the quietest, maybe the basement. I don't know, somewhere where they won't hear those noises as much will be really helpful.
We talk about behavior modification a little bit, and as veterinarians, we don't get that much behavioral training, but we know that that's that's something that we should be continually learning about. And we're not going to delve too deep into behavior modifications today, but
We don't have the time. July 4th is just right around the corner.
True. Call your vet now. But in the very near future, we are actually going to have one of my dear friends who owns an amazing dog training facility called Opportunity Barks. And we'll have her on to kind of discuss some behavioral modifications for anxious dogs related to noise phobias.
And I know, this might be sort of elementary, but if there's a loud noise and your dog is with you and you have treats in your hand, you can give them treats during those loud noises just to kind of give that a positive association. So when they hear those things that might sound scary to them, they're at least happy getting food.
Yeah, and one good thing to train your dog on that is useful in many different areas, especially in times when they're scared, is training them to go to a place, right? A place that is comfortable for them. So it could be a really comfortable bed in a room with dim light. It could be their crate that has a crate cover on it so it's dark. You could have a Kong toy with treats in it or some other delicious treat that they could have. And training them to go to this safe space is a really good training thing, but you have to train them before any of this happens.
Right, not a week before July 4th.
Correct.
All right, so let's talk about the nitty-gritty, the medications and treatments, specific things that pet owners can do, and then we'll talk a little bit more about specifics that veterinarians can prescribe, specific medications. So what are some things that a layperson can go and buy?
So actually, I was practicing yesterday, and I was actually recommending this product that I love and I truly believe in, which is Adaptil, which is used to be called DAP, right? Dog appeasing pheromone. And I remember when it came out, the mother dog gives off this calming pheromone to her puppies. And because scientists are weird and do cool stuff, they actually synthesize that pheromone chemically and they put it into a bunch of things. So Adaptil has a spray. It has a room diffuser that you plug into the wall. And it also has a collar that you can put on your dog that is good for 30 days. So Adaptil is something that you can get on Amazon, which is great. So order it right now. My dog, we use the diffuser, we use the collar sometimes. And there's another pheromone for cats, right? You can't use Adaptil. Like cats don't respond to Adaptil because it's very dog specific, but cats do respond to Feliway, which is another pheromone that actually is the pheromone that's given off when your cat rubs its face on things. So like if they rub their face on your hand or on a couch, they're actually giving off a calming pheromone.
Thundershirts and Mutt muffs are some other things that we can do, but
you can buy those over the counter.
Over the counter. Yeah. So Thundershirts, the idea is it's just a really tight harness that you put on. It's almost like a t-shirt for a dog, and it makes them feel like they're being held. And Mutt muffs are kind of what it sounds like ear muffs for dogs, so it can dull the sounds of some of these loud things. Both of these, though, I wouldn't just pull them out of the closet on this day. I would get them used to it, make sure that they are acclimatized to using these things. And there's something that, it may not work if you just try it for the first time on July 4th.
That actually may cause them more anxiety.
More anxiety, exactly.
I know when I first put the Thundershirt on Lois, although Lois is a freak. Sorry, Lois, if you're listening. She scratched it so hard that she scratched a wound into her side in front of it. So,
Jeez. All right. Well, I think those are some really great things that people can just buy without seeing their vet. But
what are some things that you need to see your vet for, Andrew?
The one that is my go-to is Trazadone.
Same.
Trazadone is great. It's got a really wide
dose range.
Dose range, thank you. I say from 2 to 8 mg per kg. Is that the same dose range you use?
Actually, there are reported doses up to 19 mg per kg per day.
I've never gone higher than 8.
Right, but there's a handy-dandy chart in Plum or on Vin that shows you, the lowest dose range and then what you can bring it up to. But that's always what I'm telling my clients is I'll give you a range and you start at the low end, but you can always double it. So I feel safe about that.
It's a really safe drug. So I would actually recommend if people are going to use it to try it out at a time when there are no noises, just to see what it does to your pet, because you might give too high of a dose and they get really sedated, or you might not give enough and you don't notice any sedation. I think you want to have a little bit of sedation in there.
Yeah.
You want to notice a little bit of sedation. So I would start at the 2 mg per kg, then go to 4, then go to 6, and then an 8. And hopefully you'll know the correct dose that works on your pet.
Yeah. And I will say anecdotal history of using this in dogs. Some dogs, it takes only an hour to show effect, but I've had dogs that it takes 4 hours.
Oh, wow.
So I always, you're absolutely right, recommend a quote trial run when everyone's at home and there's nothing crazy going on.
And if you're giving it at home, you may want to administer this, before the sun goes down, because it does last 6 to 8 hours.
True.
So you want to do it before the noises start. Otherwise, it's just not going to be worth it.
Absolutely.
So there's some other things out there. What are some other things that vets have at their disposal for this?
I feel like as vets, we're putting Trazadone in the water, but we're also putting gabapentin in the water, gabapentin for cats. But you can also use gabapentin on top of Trazadone in dogs that have, difficulties with that. But gabapentin is my go-to in cats, usually 100 milligrams per cat. But some cats are different, especially if they're underweight or they have kidney disease. I usually give half that dose. And then there is Soleo, which is a brand name drug made by Zoetis, which actually is dexmedetomidine, but it's transmucosal. So you actually apply it to the gums of your dog. Do you have any experience with that?
I have not ever used it. I have a very healthy respect for dexmedetomidine, even when doing surgery and, they're there being watched and I can reverse it. So I tend to go to Trazadone before, but I can certainly understand wanting to use this. It certainly works. What I understand with dexmedetomidine is it mimics more of like a natural sleep. So they can be aroused with noises, but they'll go right back to sleep.
Yeah. So you may see a little bit more sedation than you would with Trazadone.
Yeah, absolutely. Absolutely. Okay. And, benzodiazepines. So Xanax, alprazolam, clonazepam, Valium, diazepam, lorazepam. These are drugs that can be really abused by people.
Yeah.
And I stopped prescribing these unless I've tried everything else and I need to try the last thing. I got burned by a client who kept coming back for it for their pet, and then I found out later that they were hooked on it. So I stopped once I learned my lesson. So I would probably stay away from these and opioids, but they're certainly useful if these other, first pass meds don't work.
True. And I will make a plug right now. Everyone's probably heard this, but for diazepam, obviously we don't want to give oral diazepam to cats.
Right.
Because it can cause acute hepatic necrosis. But my dog, once again, crazy, went to the behaviorist and they did prescribe oral diazepam for her in that time frame when her other medications were coming up to, loading doses. So
how'd that work?
It actually did pretty well. But obviously, if you're prescribing diazepam orally for dogs, you want to do it in very, very low doses. And you want to make sure that, you want to be aware if refills are coming in.
Well, something that's even more, I'd say, old school would be acepromazine. And I think on its own, it's not a good one to reach for on the shelf, but it can be used as an adjunct.
True.
And what I learned about acepromazine is that it definitely sedates the animal's behavior, but not necessarily their mind.
Their mind, yeah.
So internally, they could be going crazy from these sounds, and they might not look like it to you. So
Agreed.
It's not a true anxiolytic. It's more like a sedative.
Yep, I've heard that as well.
So there's some other things that my clients have asked me for, non-medical treatments for supplements, exactly. So homeopathy, there's something called Zilkene.
Oh, yeah. I have used Zilkene, and I do sometimes recommend it actually more in cats. It's actually made from the protein in milk. I was always like, wait, how do they do that? Does that cause GI upset? But it's just a specific protein, so it's not actually milk.
It's not the lactose. It's just it's the casein proteins.
Yep.
So they did a study on another homeopathic remedy for noise phobias, and it turned out that the placebo was just as good as the homeopathy treatment. So I would probably steer away. But
clients think it works, right?
Yeah, clients think it works.
Yeah.
So if it's so mild that it can be treated with something that, that the placebo effect works, that's why for mild anxieties, I will still tell people about Zilkene. If they have severe anxieties, I'll skip right over that. I won't even go to that because I know that it won't work for anything more than a mild anxiety.
And another thing you can get over the counter that is a supplement is Composure, which is a brand name. And I like recommending those treats. And that's tryptophan, obviously, is another supplement. And if I think it's mild, I always start with Composure treats twice a day, all of the Adaptil, and a Thundershirt with some behavioral modification. if they are severely anxious, obviously, I'm like you. I'm going to let the owner have the medication and keep it and do a trial run so they have everything at their fingertips.
I feel like Trazadone is pretty much prescribed like water at this point. Like
It
for
is.
almost any anxiety, it's like, here, try this.
Yeah.
Because the side effects are minimal. I mean, nothing.
True. Well, I mean, we do have to be careful, obviously, at high doses. If they're on another medication that could cause like serotonin syndrome, do have to be careful with the high doses and check and see what else the dog may be on.
And of course, we're skipping over the big one, right? Prozac.
Well,
But we're not going to use that for like instances like thunderstorms and fireworks. That's
Well,
something more like a long-term severe
correct.
anxiety.
Yep. And obviously, my dog is on. How many times have I talked about my dog in this episode?
It's important.
She is an anxiety case, and we tried everything first, and then that didn't work. So she's on fluoxetine or Prozac. And you're right. Fluoxetine and other drugs like it can take weeks to get to levels that actually help her. And so that's something you need to discuss with your vet a long time before the summer or thunderstorms or July 4th.
Yeah. So if you're listening to this and it's a week to go before July 4th, yeah, put that one in your back pocket.
Yeah, maybe some Trazadone and order yourself some Adaptil.
Perfect. All right. Well, I think that about wraps up our little discussion. Well, I want to thank everybody for joining us today. Summer rainstorms are approaching for July 4th. It's going to be here before we know it. Make sure that you prepare, as Marisa said earlier. General practitioners out there, for pet parents out there, make sure that you're ready for these types of issues to come up. I know I will be using Trazadone on my dog this summer. What about you,
Me
Marisa?
too, obviously.
Perfect. All right. Well, listen, thanks for listening. If your platform you're listening on lets you leave a comment, please leave us one. We'd love to hear that back from you. And subscribe so you can be alerted every time we have a new episode.
For our Hot Pet Summer series, we're actually releasing episodes every week. So make sure you keep an eye on that.
Keep an eye out.
Cheers, Andrew.
Cheers, Marisa.